Mr. Secretary, our national debt is one of the greatest threats to our country. We all recognize that, and Americans are still reeling from the debilitating effects of the Biden-Harris administration. But rather than address the cause of this uncontrolled spending, the Biden-Harris administration chose to double down. And as a result, we're facing a debt crisis of our own making. The United States is on an unsustainable fiscal path with a gross national debt of $36.2 trillion, equating to over $270,000 per household. If we don't work to bring down our debt and address waste, fraud, and abuse, and it's going to cost Americans dearly, especially in the healthcare space with an aging population. We all recognize that. We can no longer afford to simply throw more money at this problem and hope for change. That's why we look forward to HHS's transformation to make America healthy again. Mr. Secretary, can you explain your vision on how the proposed reorganization can make the department more efficient and effective for patients and providers?
Yes, Mr. Chairman. Our cuts are designed to eliminate waste, fraud, abuse, redundancies, to streamline the department. During the Biden administration, we added 38% to the budget of my agency. And American health indicia, in other words, the health of the American people, actually declined precipitously. So throwing money at it, in 1986, we spent the equivalent in this agency of $250 billion in current dollars. Today, we spend $1.45 trillion just on chronic disease. And we spend, the budget of the agency is a little over $1.7 trillion. And we've gone from 11th in a lifespan in 1986 to 49th today. We are today the sickest country in the world. We have the highest death rate during COVID of any nation on earth. And that's because of our chronic disease epidemic. That's because we had the highest chronic disease burden of any country in the world. Throwing money at this agency has not worked. We need to realign the agency. We need to recalibrate its trajectory so that it transforms our healthcare system from a sick care system into a healthcare system.
Can you elaborate some on how HHS has already taken steps to do just what you described?
Well, first of all, very few of the studies that were being done by NIH were being done on chronic disease. NIH should be telling us what are seed oils doing to our children? What is corn syrup doing to our children? What are food dyes doing to our children? What is the packaging and microplastics doing to our children? What are pesticides doing to our children? None of those studies were being done. The studies that were being done by NIH and many, let me give you an example of the few that I cut. There was a study, a $2.2 million study from Boston University to study the effects of exogenous testosterone therapy on communication in gender-diverse speakers. We got a $3 million study at the University of Pennsylvania that studied anti-vaping social media campaigns targeted towards sexual gender minorities, teens between 13 and 18. We got $1 million from the University of Michigan to study sexual fluidity and longitudinal changes in alcohol misuse. And that's just an example of thousands of studies like that that were doing nothing to improve American health.
Thank you.
And we're going to change that. We're going to have gold standard science. We're going to have replicated studies. We're going to publish our data. We're going to publish our peer review, and we are going to, for the first time in 30 years, return NIH to evidence-based science.
Thank you for that. And Mr. Secretary, I'm going to submit some questions also for you to answer to highlight a couple of kids who are living with ultra-rare mitochondrial disorders like Hope with MLS syndrome and Jackson with Barth syndrome that needs your help in accessing life-saving medications. I know that you are committed to helping with orphan drugs and helping with rare diseases, and I've got some questions about that. Also, if you get a chance later on, I'd like for you to address what was done yesterday with the prior approvals. I think that was very significant. But I'm out of time. At this time, I'm going to yield back and recognize the